This is Preeclampsia Part 3. Let's talk about aspirin. First, the big question is, who needs aspirin when they're pregnant? So if you're looking at this chart here, and I know it's hard to see and I apologize, I'll list it in the comment below, but high risk. If you have any one of these in this top box over here, then you should be on baby aspirin starting at 12 weeks, 12 to 28 weeks, but ideally before 16. The big thing is history of preeclampsia or chronic hypertension, autoimmune disease, renal disease, etc. The other big recommendation is if you have any two of the following, two or more, then you should be on aspirin, right? If your BMI is greater than 30 when you start a pregnancy, if you've never been pregnant before, if you have a family history of preeclampsia like mother or sister, first degree relative, if you're 35 or older, if you have a personal history of baby born what's called low birth weight or IUGR, fetal growth restricted, any of those things, two of the following, you should be on baby aspirin when you're pregnant. This is just another image from the Preeclampsia Foundation, more of a visualization of who should be on baby aspirin. And this is if you have any one of any of these things, you should be on it. These are all based on this committee opinion here on who should be on aspirin. And the big question is why? Does it work? Why do you need it? And why is it helpful? Based on a study of 14,000 women, what they found is that there was I believe 15% reduction in preeclampsia when women were taking low-dose aspirin who were at high risk of preeclampsia. One question that was proposed is because in Europe they have 75 milligram and 150 milligram doses of aspirin, that there was a recommendation for 150 milligram to cause more of a reduction in preeclampsia. But in America, we only have 81. So someone said, what about 162 versus 81? And what they found was in this Aspirin trial is that there was no difference at all. It was all the same. The other question that was proposed is, does taking baby aspirin early in pregnancy before the first trimester, before 12 weeks, does that improve outcomes and lower the risk of preeclampsia? And that was also found to be not evident at all. So right now the recommendation is to start baby aspirin between 12 to 28 weeks, but ideally less than 16 weeks of pregnancy. So all in all, baby aspirin is super helpful. I have this theory that one day they're going to put it in a prenatal vitamin because so many people benefit from having aspirin, but we'll see, soon to come. Thank you guys for tuning in. Maybe there'll be more.